Hello everyone, my name is Alicia White. Today I'm going to be giving my informative speech on diabetes. Most people think diabetes is a condition where you cannot consume sugar. However, depending on if you have type 1 diabetes or type 2, you can still live a normal life with just a few changes. The main factor of diabetes is that your body does not produce enough insulin. Insulin is a hormone that is needed to convert sugar, starches, and other foods into energy needed for daily life. My main purpose in this speech is to inform all of you about the main facts of diabetes. I chose this topic mainly because my friend was diagnosed with diabetes when she was 7 years old. She's now lived with this disorder for about 10 years, and I became more intrigued on learning more about diabetes. I will be informing you about the different types of diabetes, their individual symptoms, causes, and the complications of living with diabetes for long periods of time. First, I would like to start off by explaining the two different types of diabetes. The two different types are typically called type 1 and type 2. Type 1 is insulin dependent, occurs in children and young adults. The body does not produce insulin, and only about 5% of people with this diabetes have this form of it, and it's usually treated with insulin, exercise, and a diabetic diet. Type 2, on the other hand, is usually non-insulin dependent. It's the most common type of diabetes, insulin resistant. In the beginning, your pancreas makes extra insulin to make up for the lower levels, and over time, however, the pancreas isn't able to keep up and make enough insulin to keep your blood glucose at normal levels. Type 2 is usually first treated with weight loss, diabetic diet, and exercise. Then, if those don't work, they use oral medications or even sometimes injections are used. Even though type 1 and type 2 diabetes sound opposite, their symptoms are somewhat the same. Each type, however, has their own unique symptom to distinguish them apart. Type 1 usually has increased thirst and urination, extreme hunger, weight loss, fatigue, and usually blurred vision. Type 2 also has all of those symptoms, but in addition includes slow healing sores or frequent infections and areas of darkened skin. Now, a short explanation of all these are increased thirst and frequent urination usually occurs when extra sugar builds up in your bloodstream, and it can cause fluid to be pulled from the tissues. This is what causes you to be thirsty and makes you drink more, which also makes you urinate more often. Increased hunger is when not enough insulin is there to move the sugar into your cells. Your muscles and organs lose energy, which causes intense hunger. Weight loss, even though you're eating more than normal, it still is possible to lose weight because when your body is unable to metabolize the glucose, it begins to use alternative fuels stored in your muscles and fats. Weight loss begins when the calories are lost due to extra glucose being released in the urine. Fatigue happens when you become tired and irritable when your cells do not get enough sugar. Blurred vision is when your blood sugars are too high and your ability to focus might be difficult due to fluid being pulled from the lenses of your eyes. Now, in type 2 diabetes, slow healing sores and frequent infections happens because it affects your ability to heal and resist infections. Areas of darkened skin usually occur in the folds and creases of your body, usually in the armpits and neck area. Now that you know these symptoms, however, it would be in your best interest to know what causes them. The causes for the two types of diabetes differ in many ways. Type 1, normally your immune system fights harmful bacteria or viruses. However, in type 1 diabetes, your immune system attacks and destroys your insulin-producing cells in your pancreas. This leaves you with little or no insulin, and instead of being transported into your cells, the sugar builds up in your bloodstream. Type 1 is usually caused by a combination of genetic weakness and environmental factors, though some of those factors are still unclear due to research being done. Type 2. In type 2 diabetes, your cells reject the action of insulin and your pancreas is not able to make enough insulin to overcome the rejection. Sugar begins to build up in your bloodstream instead of moving into your cells for energy. Although it has not yet been proven, it is said that genetic and environmental factors play a large part in the development of type 2 diabetes. Being obese is also a large part in the development of type 2 diabetes, but not everyone with type 2 is obese. Lastly, you should all know the complications of living with diabetes. The longer you have diabetes and the less controlled your blood sugar is, the higher the risk of these complications. After a while, all these complications can result in death or even a disability for life. Possible complications include cardiovascular disease, nerve damage, kidney damage, eye or foot damage, mouth and skin conditions, osteoporosis, Alzheimer's disease, or even sometimes cancer. Even though some of these complications only happen in severe cases, it is still very possible that anyone living with diabetes can have any of these problems. I hope that after hearing this speech, you feel more informed about this very common disease and realize that it can happen to anyone. I myself have not been diagnosed with diabetes, but seeing my friend live with it has definitely had an impact on my life and has made me more aware about the foods I eat, the activities I do, and being more active just to make sure to lower my risk of getting diabetes. I would like to thank you all for taking time to watch this speech, and I hope that you have all learned something today. Thank you.